Nursecyclopedia, a nursing must-know assessment guide for nursing besties out there.
Hello, nursing besties! Our topic for today is all about the physical examination of the head, neck, and other related lymphatics.
Come and join us in learning today's assessment besties. So, for the preparation, prepare all the necessary equipments. Examination gown, clean non-sterile examination gloves, glass of water, penknife, cotton mist, and wooden thumb plate. So next, we have to prepare the patient and the environment. Explain the procedure to the patient. So next, we will position the client appropriately. So in this case, we will position the patient in a sitting position. And then next, we will ensure the client's privacy by closing all the doors, the windows, and the curtains. Next, we will instruct the patient to drape himself or herself appropriately. Next, make sure that the environment is with adequate light and the room temperature is regulated. And lastly, wash hands or perform proper hand hygiene. So in the assessment of the head, we will inspect and palpate the skull. So first, we will inspect the size of the skull.
So here, we will inspect the shape and the size of the skull.
So next, we will inspect and palpate the shape of the skull.
To assess shape, place your fingers in the person's hair and palpate the skull. Note that cranial bones that have normal protrusions are forehead, the side of each parietal bone, the occipital bone, and the mastoid process behind each ear.
And lastly, we will palpate the temporal area.
Palpate the temporal artery above the zygomatic or the cheekbone, between the eye and the top of the ear.
So next, we will inspect the face of the patient. So here we will inspect the facial structures.
Inspect the face, noting the facial expression and its appropriateness to behavior or reported mood.
Inspect the eyes. Inspect external ocular structures. Note person's ability to move around the room. Note also the facial expression. Inspect the eyes for size, alignment, and placement. Inspect the eyebrows. Look for symmetry between the two eyes. Inspect eyelids and lashes. For the eyeballs, test for eyeball movement.
Ask patient to follow the object with his eyes without moving his head. Nurse moves the object to each of the 6 cardinal positions, returning to the midpoint after each movement.
Inspect conjunctiva and sclera.
Ask the person to look up. Using your thumbs, slide the lower lids along the bony orbital rim. Take care not to push against the eyeball. Inspect the exposed area.
Lacrimal apparatus.
Ask the person to look down. With your thumbs, slide the outer part of the upper lid up along the bony orbit to expose under the lid. Inspect for any redness and swelling.
Cornea and lens. Testing corneal reflex.
By lightly touching the cornea with wisp of cotton.
Iris and pupil. Note size, shape, and equality of the pupils. Test the papillary light reflex. Test for accommodation.
Ask the person to focus on a distant object. This process dilates the pupils. Then have the person shift the gaze to a near object such as your finger, held about 7 to 8 cm from the person's nose. Place the Snellen alphabet chart in a well-lit spot at eye level. Ask the person to read through the chart to the smallest line of letters possible.
Test visual fields. Confrontation test.
Position yourself at eye level about 2 feet away. Looking straight at you, the person covers one eye with an opaque card as you cover the opposite eye.
The ear assessment, starting with inspection and palpation of the external ear. First is we're going to inspect the size and shape of the ear.
Size and shape should be equal sized bilaterally with no swelling or thickening. Ears of unusual size and shape may be a normal familial trait with no clinical significance.
Next is skin condition.
Skin color should be consistent with the person's facial skin color. Skin should be intact with no lumps or lesions.
Next is tenderness.
Move pinna and push on the tragus. They should feel firm and movement should produce no pain. Palpate the mastoid process. It should feel no pain.
Moving on to the external auditory meatus.
No swelling, redness, or discharge should be present. Some cerumen is usually present. Color varies from gray to yellow to light brown, black, and the texture varies from moist, waxy to dry and desiccated.
Next is external canal.
Note any redness and swelling, lesions, foreign bodies, or discharge. There should be no redness, swelling, or lesions. If any discharge is present, note the color and odor.
Next is the whisper voice test. You're going to stand 2 feet away from the patient. The patient is covering his tragus, and I'm going to whisper a combination of letters and numbers to his ear, and he should repeat it. 1,
312
3, 3,
33B
C, 8.
C8
Okay, now moving on to the next ear.
BB3
1, 2, C,
1 2
4.
AB4
That concludes the inspection and palpation of the external ear.
Nose. Inspect for deformity, asymmetry, inflammation, or skin lesions. Test the patency of the nostrils. This reveals any obstructions which later is explored with the nasal speculum. Nasal cavity. Inspect the nasal mucosa. Note for the color, swelling, discharge, bleeding, or foreign body. Observe the nasal septum for deviation. Note for the perforation or bleeding in the septum.
Palpate the sinus area.
Test olfactory nerve. Ask the patient to close his or her eyes and block one nostril and inhale a familiar aromatic substance through the other nostril. Lips. Inspect the lips for color, moisture, cracking, or lesions. Teeth and gums. Inspect the teeth and gums. Compare the number of the teeth with the number expected for the person's age. Ask the person to bite as if chewing something and note alignment of upper and lower jaw. The tongue. Check for the color, for the surface characteristics, and the moisture.
Inspect also the buccal mucosa for color, nodules, or lesions.
The palate. Shine your light up to the roof of the mouth, the throat. With your light, observe the oval, rough surface, tonsils behind the anterior tonsillar pillar.
And lastly, for the neck, we need to inspect the neck for symmetry. And then we need to test for muscle strength. Then we need to test for range of motion.
Ask the patient to touch the chin to the chest, turn the head to the right and left, try to touch each ear to the shoulder. Note any limitation of movement.
Next, we need to inspect and palpate the lymph nodes.
Using a gentle circular motion of your finger pads, palpate the lymph nodes. Begin with the preocular lymph nodes in front of the ear. Palpate the 10 groups of lymph nodes.
Next, we need to palpate the trachea for tracheal shift.
Place your index finger on the trachea and the external notch and slip it off each side.
Go. Next, we need to inspect thyroid gland for size and visible masses.
Go.
Then we need to palpate thyroid gland.
For the posterior approach, palpate thyroid by standing behind the client.
Go. And we need to inspect external jugular veins. So after doing the assessment, we need to document our findings.
That's all for today, Nursing Besties. Thank you for watching and see you on our next episode.
Bye!